Hey there! Have you ever heard of phantom limb syndrome? It's a mysterious condition that affects people who have had a limb amputated. Even though the limb is no longer there, they can still feel pain, tingling, and other sensations in the missing limb. In this video, we're going to take a closer look at this fascinating condition and explore some of the latest research and treatment options available. Anatomy and physiology. So, how does the brain process information from the missing limb? It turns out that when a limb is amputated, the brain is still sending signals to the missing limb, which can cause the sensation of phantom pain, itching, or even temperature changes. This is because the sensory and motor cortices in the brain are still active and trying to make sense of what's happening. In fact, studies have shown that the brain can even rewire itself to accommodate the missing limb, which is both fascinating and a bit spooky. Causes and risk factors. There are many factors that can lead to limb amputation, from accidents to medical conditions such as diabetes and cancer. The level and type of amputation can also affect the likelihood of developing phantom limb syndrome. For example, people who have had a limb amputated at the shoulder or hip are more likely to experience phantom sensations than those who have had an amputation at the wrist or ankle. Psychological factors such as anxiety and depression can also play a role in the development of phantom limb syndrome. Types of phantom limb sensations. People with phantom limb syndrome can experience a wide range of sensations, from pain to itching to pressure. These sensations can be triggered by a variety of factors, including temperature changes, emotional stress, and even memories of the missing limb. For some people, the sensations can be so intense that they interfere with daily life and lead to depression and anxiety. Diagnosis and treatment. Diagnosing phantom limb syndrome can be challenging, as there is no single test that can definitively diagnose the condition. However, doctors can use a combination of physical exams, imaging tests, and patient interviews to make a diagnosis. There are many treatments available to help manage the symptoms of phantom limb syndrome, from medications to prosthetic devices to alternative therapies such as acupuncture and hypnosis. Coping strategies and support. Living with phantom limb syndrome can be challenging, but there are many self-help strategies that people can use to manage their symptoms. Distraction techniques such as meditation and deep breathing can be helpful, as can exercises to improve flexibility and strength in the remaining limb. Joining a support group or seeking counseling can also be beneficial for people with phantom limb syndrome and their families. Future directions and research. There is still much to learn about phantom limb syndrome, but there are many exciting developments on the horizon. Emerging technologies such as virtual reality and brain-machine interfaces show promise in revolutionizing the treatment of the condition, while ongoing research is helping to better understand the complex processes that lead to phantom sensations. Conclusion. In conclusion, phantom limb syndrome is a fascinating and mysterious condition that affects millions of people worldwide. By raising awareness of the condition and providing support and resources for people living with it, we can help to improve the lives of those affected by this unique and complex condition.